Good morning, ladies and gentlemen. All protocol observed. My first words are to say thank you to Apollo, thank you to India, to invite Mozambique to participate in this very important meeting, very relevant to Mozambique at this stage of cooperation between India and Mozambique in field of health. What I'm going to do is to share my vision about healthcare in our continent, in Africa, where Mozambique is placed. Healthcare is one of the most complex and difficult enterprises on the planet. It is changing with great speed and turbulence. Healthcare demands in Africa are changing. Ensuring access to clean water and sanitation, battling ongoing communicable diseases, and stemming the tide of preventable deaths still dominate the healthcare agenda in our countries. However, the incidence of chronic diseases is rising fast, creating a new matrix of challenges for Africa's healthcare workers, policies makers, and donors. A growing urban middle class is willing to pay for better treatment. This has opened the door to the private sector, which is starting to play a new role, often working in partnership with donors and governments to provide better healthcare facilities and increase access to medicine at an affordable price. For the vast majority of Africans still unable to pay for health provision, new models of care are being designed as governments begin to acknowledge the importance of preventive methods over curative action. This in turn is empowering communities to make their own health decisions. At the same time, some countries are experimenting with different forms of universal health provision. Like many other regions, Africa must reassess its health system to ensure that they are viable over the next decade. Unlike other regions, however, Africa must carry out this restructuring while grappling with unique broad range of healthcare, political, and economic challenges. The continent, already home to some of the world's most impoverished populations, is confronting multiple epidemiological crises simultaneously. High level of communicable and parasitic disease are being matched by growing rates of chronic conditions, although the communicable disease, like malaria, tuberculosis, above all HIV/AIDS, are the best known. It is the chronic conditions such as obesity and heart disease that are looming as the great threats. These are expected to overtake communicable diseases as Africa's biggest health challenge by 2030. Additionally, continued high rates of maternal and child mortality and the rising rates of injuries linked to violence, particularly in urban areas, are weighing down a system that is already inadequate to the challenges facing it. Healthcare delivery infrastructures is insufficient. Skilled health workers are crucial. Medicines are in short supply. And poor procurement and distribution systems are leading to unequal access to treatment. The financing system is as deficient as healthcare delivery system that it supports. Public spending on health is insufficient, and international donor funding is looking shaky in current global economic climate, in the absence of public health coverage, the poorest Africans have little or no access to care. What is more, they frequently also lack access to the fundamental prerequisites of health: clean water, sanitation, and adequate nutrition. Despite these major challenges, reforms of the continent's healthcare system are possible. Indeed, some evidence of reform is already present. Considering the massive challenge facing Africa's healthcare system, several major reforms will be needed continent-wide to ensure their viable in the long term. Shifting the focus of healthcare delivery from curing to preventive care and keeping people healthy. Giving local communities more control of healthcare resources, improving access to healthcare via mobile technologies, advances in health-oriented telecommunications, medical imaging, massive databasing, memory miniaturization, satellite technology, and other information system lay the groundwork for fundamental changes in the organization of healthcare. Tightening controls of medicines, medical devices, and improving their distribution. Outcomes, measurements, uses, massive database scanning millions of cases to determine what therapies actually work best in particular circumstances. Reducing reliance on international aid organizations to foster development of more dependable local supplies, extended universal health insurance coverage to the poorest Africans. Implementation of the reforms could strongly influence the future shape of healthcare in Africa. 5 scenarios for the future. Following are potential scenarios depicting the possible health landscape on Africa continent future. Refocusing on primal and preventive care. Empowering communities as healthcare providers. Implementing universal coverage. Making telemedicine more available. Encouraging local suppliers. In conclusion, by next year, a number of African countries may have found a way to rethink and restructure their healthcare system so that they are fit for purpose, making care available to a majority of their citizens and improving health outcomes. The first challenge for African governments will be increased investment in healthcare, particularly in the majority of countries still failing to meet the spending targets. This is likely to involve hard potential choices, as well as unacceptable by governments, that healthcare represents a critical investment in their populations and countries. This evolution, coupled with the growing middle class, will likely lead to great expectation and grassroots pressure for increased healthcare investment. Also, my last consideration is about the report of Lancet Commissions on Investing on Health, Global Health 2035. This report makes important conclusions and identifies the opportunities of action by both national governments and international communities that could have a transformative effect on health and the economy. The most important conclusions are: there is a very large payoff from investing in health. This new understanding of economic value of health improvements provides strong rationale for improved resource allocation across sectors. A grand convergence is achievable within our lifetime. A unique characteristic of our generation is that With the right investment, the stark difference in health indicators between countries of differing income levels could be brought to an end within our lifetime because of economic growth and the increasing availability of high-impact health technologies. A scale-up of low-cost packages of investment can enable major progress in NCDs and injuries within a generation, delaying the onset through non-cost or low-cost population-based interventions and fiscal policies, reducing the incidence and manage correctly the cases. Good reasons exist to be optimistic about seeing the global health landscape completely transformed in this way within generations. With economic growth in many low-income countries, the digital revolution and the scientific advances, we envision accelerations in spread of health knowledge among public and health workers and in the dissemination of policies that allow nations, decision makers to fully reap the fruits of global science. Thank you very much for your attention.